minutes as a wait for. So our icebreaker for today is, what's one thing on your bucket list that you're hoping to check off soon? What's one thing on your bucket list that you're hoping to check off soon? For me, I'd say there's some Ethiopian cuisine that consists of raw liver that I'd like to try. Hopefully I'll get to do that this year. But to all of you, what's one thing on your bucket list that you're hoping to check off soon? Kind of put your answers on the chat as we wait for others to settle in to kick off today's webinar. Thank you. With others checking, we're about to kick off our webinar in the next 2 minutes. We have a fun icebreaker question for you on your screen. What's the one thing on your bucket list that you're hoping to check off soon? Kindly put your answers on the chat or feel free to come off mute as we wait for others to settle in and kick off today's Global Goods webinar. Hi, Amaris, I see your answer. Oh yes, language classes. That is a good one. In today's world, the more languages you know, the better it is for you. Thank you for that. Welcome everybody to today's Global Goods webinar, where we'll have a presentation from Spice. And as we wait for others to check in, we have a nice fun icebreaker question for you on your screen. What is the one thing on your bucket list that you're hoping to check off soon? Feel free to come up here to put your answers on chat. We will begin the webinar in the next 2 minutes. Thank you and welcome everybody. Good morning, good afternoon, good evening, whatever time it is where you are. Today we'll have our Global Goods webinar where we're introducing one of our 3 new global goods. And today we'll go through a presentation with Spice. So just to kick off the webinar, we'll begin with a quick poll question where we're asking, how do you rate your overall knowledge of global goods? Not much, I know quite a bit. I know all about global goods. Kindly give us a quick response to this poll question as we kick off this webinar. So for those just joining, we have a quick poll question for you. How would you rate your overall knowledge of global goods? Not much, you know quite a bit, or you know all about global goods. Kindly respond to the poll question. Let's begin to kick off the webinar. Okay, thank you all for your responses on that. Always great to wear your knowledge in global goods before we kick off. So to begin, the agenda for today, we'll just have a short introduction to global goods, and then we'll hand over to Spice to give us a presentation on everything Spice and have some time for any questions and answers. So to begin with the introduction, from the poll results, I see not much is 26%, quite a bit is 63%, and I know everything about global goods is 11%. That is quite good ratings. We'd like to move the not much to quite a bit and the quite a bit to I know everything about global goods. Hopefully we'll get closer to that in today's session. So to begin with an introduction of global goods, they're impactful open source solutions designed to improve health outcomes in a global scale. So here's what makes them unique. Global goods are open source, meaning they are free to use, adapt, and share. This fosters innovation and collaboration across diverse regions and organizations. The tools are specifically designed with health systems in mind, aiming to improve public health delivery and outcomes in low resource settings. So each global good is backed by a robust community of contributors, ensuring continuous improvement and sustainability. A clear governance structure provides leadership and coordination. Global goods also receive funding from various donors and organizations, ensuring a broad base of support for their development and maintenance. So designed to be flexible, these tools can be easily adapted and scaled to different country contexts and health systems. Many global goods have demonstrated success in real-world implementation, showing their value in improving health outcomes globally. So today we're excited to announce that we've recently added three new global goods to our collection. You can explore this along with others in the Global Goods guidebook, which we'll share the link in chat. Today we'll be showcasing one of these new additions, Spice. We'll dive into how it works, its impact, and why it's a valuable tool for health systems worldwide. So I'll begin by introducing our speakers for today. We have Kelly Battle, who's the head of technology at Medtronic LABS. We have Selva, who's the senior product manager at Medtronic LABS. And we have George Bush-Odhiambo, who's the software systems engineer at Medtronic LABS. So without further ado, I will hand it over to Spice to carry on the presentation.
Thank you. Just going to pull up my slides and then we'll go ahead and get started. All right. Good morning, good afternoon, good evening, everyone. Thank you for joining. My name is Kelly Batye, and I'm the head of technology for Medtronic LABS. Today, during the session, we'll be going through an overview of Medtronic LABS and the Spice platform. And then we'll be diving into a live demo of the platform, specifically focusing on our 2.0 release, which we're very excited to announce. And then we'll be walking through our community engagement and resources that we have to share, followed by a Q&A at the end. So to get things started, at Medtronic LABS, we take a bold approach to last mile healthcare delivery, and our mission is to expand access to healthcare for patients, families, and communities across the world. In terms of our program operations, we are currently driving to scale across multiple countries. We have executed programs since 2019, specifically focused across countries in sub-Saharan Africa. We've got program operations in Kenya, Ghana, and Sierra Leone, as well as in recent years, we've expanded our programs into the United States, Bangladesh, and Bhutan. And one of the metrics that we really highlight is the lives improved. At Medtronic Labs, we really focus on driving measurable outcomes. And so, how can we use technology to focus on driving outcomes as well as health systems efficiency? From our foundation, we started our models focused on chronic disease, specifically building tech-powered models for non-communicable diseases, hypertension, and diabetes. And in doing this, we built a real strength in longitudinal patient management using clinical risk stratification and clinical decision support to prioritize patients for referral and for follow-up, creating a really strong linkage between community health work and facility-based care. We believe really that longitudinal patient management, risk stratification approach, and bidirectional linkage are some of the unique value propositions of the SPICE platform. And now we're focused on reimagining primary care, expanding beyond non-communicable diseases to include clinical areas such as malaria, TB, maternal and child health, immunization, and more. Really looking to work with health systems to transform primary care. At Medtronic Labs, we take a three-tiered approach. The first being bringing the technology, in this case, SPICE, which is an open source software platform designed for primary care. In addition to SPICE, we have targeted time-bound implementations that are really data-driven with our SPICE Insights product, as well as we bring research partnerships that are really looking to prove that value of the program at scale. And what makes SPICE different as a global good for health? We really have a focus on measuring clinical outcomes. So at every level of the health system, we leverage data science and analytics to improve population health and lower costs. Again, that risk-based longitudinal management, which you'll see more in the demo today, and the bidirectional linkage from community health workers and the screening and activities at the community, linking to the health system and having that bidirectional referral. We've embedded clinical decision support in the platform at all different tiers of the health system to really enable that efficient patient management and resource allocation. And then we also couple SPICE with service delivery innovation. So moving beyond just the data collection of the software tool itself. We're currently focused on reimagining primary care, integrating the different disease areas that you see here, and supporting a wide variety of users at multiple levels of the health system. So with the application, we support community health workers, doctors and nurses at the facility, all the way up to National Ministry of Health stakeholders with our DHIS2 integrations to ensure that data is flowing at an aggregate level from a reportability perspective. All of this building bidirectional linkage across a health system from the community health worker level at that household into the primary healthcare centers. So now I'll go into the SPICE platform specifically itself. So SPICE 2.0, which is what we're going to be detailing today, has been designed to be a next generation primary care platform. At its core, our clinical modules have algorithm-driven disease pathways for non-communicable diseases, malaria, HIV, child health, immunization, and those closed loop risk-based follow-ups at the community and at the facility levels drive this coordination of care. From an operational perspective, the application has administration features, customized dashboards, a way for users to view staff performance metrics, as well as monthly summary reports. And then lastly, the Spice Insights component, which is an incredibly important piece to enable the different stakeholders to make those data-driven decisions. So Spice Insights provides those real-time outcomes tracking by disease area, creating operational KPIs at every level of the health system so that community health workers can view their own KPIs and metrics for the activities that they're performing, as well as those higher level ministry officials that can see analytics on a population health basis. To bring Spice to light even further, I think it's helpful for us to walk through our service blueprint. So, from a patient's perspective, what does their journey look like? What are the different user roles that engage? And how specifically does Spice enable that? In the case of a patient, everything starts at the community level, in which a patient would be registered and screened or assessed at either a household registration or at a screening camp. And this is conducted by a community health worker. Spice as a technology provides offline first workflows to screen, assess, and register these households. The Spice technology has the clinical algorithm that has referrals that are customized based on each WHO guideline and contextualized to the local context. These referrals are then sent to the nearest facility seamlessly with the platform. So a patient, after being screened and assessed, they'll be referred to that nearest health facility for a medical review and receive an SMS reminder to remind them to seek that further care. All the while, clinicians can view these referrals in the Spice platform to understand what's happening in real time. At that next stage of the patient's journey, they would seek care at the facility level to receive a medical review with a clinician to confirm a diagnosis and receive care. The Spice platform provides the ability for the clinician to conduct that medical review, prescribe any medications, order lab tests and investigations, all of which is assisted with clinical decision support. This medical review also starts to build out that longitudinal patient record, as we have the information that was collected by that community health worker at the community is already present in that patient's record. And they continue to build in that record with every touch point that that patient has with the health system. The Spice application, after receiving that confirmatory diagnosis, uses risk stratification to create a risk-driven treatment plan that's customized for that patient's diagnoses and risk level that the application determines. The patient then receives their clear treatment plan and next steps. A community health worker within the application then receives that counter referral because the patient is meant to then receive home visits followed up by the community health worker on a specific interval. So that community health worker then receives a targeted list of patients that's stratified by that clinical need and risk that they will then go to follow up with. All the while, the clinician receives an ongoing visibility of that patient data that's collected at the community level, as well as an ability to do any telehealth follow-ups. The Spice application enables this through SMS reminders, risk-driven follow-up lists, and ongoing population health analytics and through the Spice Insights. This is all repeated. So once a patient is enrolled in the program and receives that customized treatment plan, it then starts a process of both community-based case management as well as facility visits for medical reviews, prescription management, and different things like that. And all of this will become much more clear as we enter into the Spice platform demo. The last piece that I want to highlight before we dive into the Spice demo and the feature sets is that Spice 2.0 is now FHIR enabled. We have taken the steps to build Fire native elements to allow for enhanced interoperability with the platform. And we believe that there's a lot of benefits to this approach. Mostly, it allows for faster, more nimble development timelines, supports the adoption of WHO SMART guidelines, and really enables interoperability between different HMIS systems. And so we're very excited with our 2.0 release that Spice is officially Fire enabled. And we're already working with a partner to enable an integration with this approach. And so with this, I would like to hand it over to Selva to walk us through a couple of the features within the Spice platform, as well as a live demo. So Selva, over to you.
Thanks, Kelly. Hi, everyone. My name is Selva Ganesan, and I work as Senior Product Manager at Medtronic LABS. And I'm based in Chennai, India. So I'll quickly start with the key features first, just the highlights on what features we have in Spice. And then from there, we will see a quick demo of one particular workflow, how it happens between community and in primary healthcare facility. So yeah, Spice is an integrated primary healthcare platform that connects community-based health services with primary healthcare facilities, providing a unified system that tracks patient care across the different levels of health system. And also it helps the healthcare providers to collaborate between themselves to improve patient outcomes. So in terms of first touch point of the patient is screening and referral, and community health worker does household registration and member registration at the community level, in places where it is really hard to reach, for screening and all. So in terms of these community screening, first the community health worker does the household registration, and then he does the member registration, that is who all are there in the household, and then he does the member registrations of the family members who are there in the particular household. And then based on certain protocols, they start to screen the patient. So we have screening workflows for different disease conditions like hypertension, diabetes, malaria, diarrhea, different disease condition screening protocols are there. And we also have clinical decision support at every touch point. So basically at the screening part, what will happen is the community health worker does the screening, and at certain disease conditions, at certain symptoms, if there are certain symptoms that can be treated at community level, the community health worker dispenses few medication and assesses the patient for some time. If the condition is not improving, then the patient is referred. And also based on the protocol, if the condition, there are some conditions that need immediate referral. So Spice will enable the CSW to make decision of what conditions are serious, and also it stratifies the risk based on patient's current condition, and it shows the message accordingly. If the patient needs an immediate referral, the patient will be referred to the primary health center immediately, or else in terms of any initial treatment that is required, a community health care will be able to treat the patient. So this is the part of community screening and referral. And also in case if the patient isn't screened, a physician who is using Spice at the primary health center level will be able to see why the patient is referred, the reason for referral is shown to the physician. So this is about the initial community screening and referral part. And all the algorithms that are there are based on WHO's guidelines, and also we tweak it based on the country's health guidelines also. It is mix of both WHO guidelines and also the country's health guidelines. And the next set of feature is prioritized follow-up list. So what happens in the whole patient journey is, once a patient is referred to a primary healthcare center, a physician treats the patient at the primary health center. And it is not only about referring the patient and treating the patient at the primary health center level, but also continuously following up with the patient on a regular basis until the patient is recovered from a certain disease condition, right? Like if they are having like malaria or like diarrhea problem, once the treatment is completed by the physician, we have like automated like algorithms that are there that generates a patient list to the community health worker who are very close to the population, right? Like who are very close to the patients. So we generate like patient list that requires like follow-up from the community health worker, and then the community health worker, based on the prioritized follow-up list, has like two scenarios here. Either the community health worker can call the patient and understand if the patient is doing well or if the patient needs to go to the facility or not. There is another scenario where the community health worker has to do a household visit of the patient to do a follow-up assessment. So we make sure that the loop is closed here. The patient has to be recovered. Until the patient is recovered, the treatment will be continuous between both the community health worker and also the physician at the primary health center. And yeah, so this is one set of, and also we have like features to call directly from our mobile app, which I will showcase to you in the live demo. So yeah, we can go to the next slide. And next one is like longitudinal patient record. So in terms of longitudinal patient record, like we have features to showcase what has been the patient medical history, the time when the patient's first touch point, from time when the first touch point happens till the current state of the patient. Every medical review and assessment that has happened with the patient is visualized and showed to the physicians to make like decisions at the community level or at the facility level. So this shows the whole medical review history of the patient. It shows like prescription, lab investigation, what are the lifestyle the patient is going through, and also the data flows between both community and at the facility. Both are like seamlessly interlinked and bidirectionally linked. So whatever happens at the community is visible to the physician who's at the facility, and simultaneously whatever happens at the facility will be visible for the community health worker here to make clinical decisions and treat the patients accordingly. And like everything, like it's all like algorithm driven pathways for all the disease condition that we have. And also all the algorithms are based on like, the country guidelines and also the WHO guidelines that are there. So here you can see the graphical representation of how blood pressure and blood glucose values are differing over time. So this is like an NCD touch point that has happened here. And so that's been showcased in a visualized format. So this is one set of feature, and we can go to the next slide. Yeah, so the next one is like clinical decision support, which is like being like the clinical decision support is there in every touch point when the patient interacts with the spice. Like when a physician or a community health worker is, interacting with the patient and is performing screening, assessment, or medical review for the patient. At every touch point, we have a clinical decision support in SPICE, where like based on like algorithms, we stratify the risk of the patient on like the respective disease condition the patient is being treated for. And also we have like personalized recommendation and personalized treatment plan that are generated based on WHO algorithms, based on like the HEARTS algorithm, PEN protocol and all. So we also generate like customized treatment plan, but physician will have the ability to change the treatment plan according to the nature of the patient's diagnosis. And also we send like constant clinical reminders to the physician to remind the physician about certain lab investigation. For example, if based on like protocols, the diabetic patient should undergo a HbA1c test like every once in 3 months. So if the lab investigation is not been requested by the physician, SPICE automatically notifies the physicians to recommend a lab investigation, but still we are not forcing the physician to request a lab investigation. We are just like notifying and nudging the physician to request for a lab investigation of HbA1c. Similar to that, we also have like algorithms to understand what's the current patient condition. For example, if the patient's blood pressure values are not improving over time, and if the medication is not changing, we send like nudges to the physician, notifying the physician that the patient's values are not improving would you like to intensify the treatment, which means to like add more dosage to the medication, for example, or like intensify the medication so that the values of blood pressure will improve. So like that, we have like clinical reminders and notifications and nudges for the physician to improve patient outcomes. So at high level, like these are some of the key features that we have in Spice. Now I think we can quickly go through the like platform demo once, and then we can come back again to the data pipeline and the Fire hybrid architecture that we have. So I can share my screen. So hope you all can see my screen. So like this is the community health worker app. I'll just start like I'll start from like what will happen from the first touch point. So this is the households, like list of households that every community health worker is mapped to a particular village where the community health worker is responsible for that particular village's health management. So here I'm going to add a household. So let's assume that I'm a community health worker and I'm going to add a household from my particular village that's there. So we take like consent before consent before registering any household here. So I'll start from like household name here. So it like we should also provide the number of households that are there, and we have like some WASH criteria questions that are like embedded in the platform, and we also use this data to interpret and show insights out of this data at like the household level and at every village level. And now I'm going to add the members. So I've completed the household registration. The particular household has been registered. Now I'll add the member in the family that are there. So I'm adding the household heads details here. I've added like one member here, so I'll add like another member. So every member will have an member ID, like which is the patient ID that's there. So I'll add the the son or daughter details now. So I've added all the details. You can see here it's showing in red because I haven't completed all members like registration here. So now let's assume like Richard is having like Richard, son of like Roman is having and like fever for like 10 days. So I'm going to open ICCM. So ICCM module is called like Integrated Community Case Management module that is basically designed to provide like life-saving treatment for common children illness like malaria, pneumonia, and diarrhea in hard to reach communities. This is designed specifically for workflow is designed specifically for these conditions in hard to reach communities for community health workers. So in this particular scenario, a trained community can diagnose and treat these diseases at the community level by improving access for like healthcare for like the children who are under 5. So I'm going to like do the screening of the like assessment of the patient here. So I'm going to check like MUAC, and we also have educational material for CSWs to how to do like MUAC assessment and all. So in this case, we are having like, let's assume we are having just the fever scenario here, and we'll enter all the details of the patient. So based on the protocol, if it's greater than like 7 days, we will have to perform an like RDT test. So here, like, let's assume like the RDT test is positive, and like the community health worker is not dispensing ACT medication. So ACT tablets has to be dispensed here. So let's assume in this scenario, it's not being like dispensed. So now I'm submitting this assessment. So it says like referred for further assessment. So the community health worker now will refer the like, you know, the child or the like will tell them mother of the child to take the child to the nearest health center. So I'm referring the child to the health center called like Care for Life. So, and it also has like all the summary of the details that we are capturing here. So I'm going to submit it. And then since this is like, you know, offline, I'll just like do, it's all like end-to-end offline. So now I'm going to the community, so now let's assume the child has gone to the health facility which is nearby, primary healthcare that is nearby. The physician will have a different view of SPICE. So physician will be using a tablet version. So yeah, once this is uploaded, it will start like reflecting here. Let's give it a like 20 seconds and then. So we have like Richard, the child who was referred here. So you can see a referral ticket is generated on in terms of a date of onset and referral date, and also the reason for referral, why the child has been referred. This is the first touch point. So I'll quickly start the medical review for the patient. So you can see a different health registers are there. These are all like country registers are based on like country guidelines that we have designed. So for this particular scenario for fever, I will choose like under 5 years old, between 2 months to 5 years. And then uh, I'll do the medical review for that particular patient. So I'll do one like RDT test at the facility, and then I'll start the diagnosis here. So I can confirm the diagnosis as like malaria, and then weight in kgs we can add like height like centimeter, and VAS values like weight to age weight to age ratio based on like reference population, and then weight to height scenario based on like reference population values that we can enter here. And then we can also like do the MOAC measurement and other measurements. So immunization status, we have an comprehensive data that we need to collect to like treat the patient here. We can add like presenting complaints. And then we have like different like disease condition, like different like symptoms that are like noted here. So in this case, we'll choose like fever, and like mother has fever negative, and then number of days. So here in this case, we are also like checking signs for the mother as well. And then, yeah, so I'll like enter all the details here. And then we have like for different problems that are there, like diarrhea, cough, difficulty in breathing, we will collect those details here. And then we will do a systemic examination if needed. This is like optional only. So now to submit the medical review. So this is very comprehensive. Based on the disease condition, we can select like what we will need to do, and then we will have to proceed from that particular scenario. So now I'll add the scenario here. And also we also have the ability to add medication and lab investigation here. So for example, if I want to add any medication, I can add like the medication here. So I'm just adding a medication to showcase this. So I can dispense the medication, and then that's also been like recorded. So the next one is like we'll have the once the treatment is started, it will automatically change the patient scenario to on treatment, and I will have to give the next visit date here. So this I'll choose the next visit date in like next 2 days. And this is the medical review, and I'm completing this medical review now. So the patient's like value, like you can see here, the whole patient history is reflected here. of what has been recommended before, like prescription that we have given, what is the medical review history. And this is very comprehensive. So they can actually go between like different dates and see what the patient is having. So now I'll quickly come back again to the CSW workflow. So now the patient's treatment and medical review date has like started. Treatment has also started. So one critical thing that the CSW needs to do now is to follow up with the patient. So now the treatment is completed. There are 3 criteria that are there. Household visit is nothing but once in a while, the CSW needs to go to the particular household and needs to make sure that everyone is doing good. So in this case, we'll do the household visits once in like 3 months. We will generate the patients who needs to do an household visit, and we will showcase here like the data is not populated because of it since it's a test environment. So in this scenario, primary health center, but that particular patient is not going to the primary health center. After some days, like 6 days overdue, it's showing, which is this patient has to go, but the patient is not going. So in that case, the CSW will make a phone call to the patient here, and then 1 second. So now the phone call is made directly from the Spice platform. So I can record what was the conversation about, like if it is successful or an unsuccessful call. And I can say it is a successful call and I can close the loop. Similar to that, we also have like medical review follow-ups for patients who are due as well as who are upcoming. So as a CSW, I can proactively follow up with the patient to know if the patient is ready to visit the primary health center or not. So we have this follow-up generated based on like, risk algorithms and also in terms of the patients who are due for the treatment. So this is like the patient follow-up that happens at the community level. And also if somebody calls the community health worker saying they have like some problem, the community health worker will now go to the household and will, assess the respective patient who is having a problem. For in this case, it can be an RMNCH scenario, reproductive and maternal care, right? So if somebody is pregnant, they will do like a pregnancy screening and they will start the treatment for people who need like pregnancy assessment. So this is like an end-to-end flow, and this is repetitive. So if I refer someone, it will get reflected as a patient who has like referral from the community to the facility. So these two are the workflows that are there. So community health worker workflows at the community, and we have like the community health officer workflow, which is the physician workflow that's there. So yeah, this is like the live demo that we wanted to like show. Now I think we can go back again to the slides.
Thank you, Selva. That was fantastic. So as Selva demonstrated, the SPICE platform provides that integrated community health screening across the varied disease states. In the demo, we gave an example of the household registration, screening a child for a suspected case of malaria, as well as what that closed loop risk-based follow-up looks like between both the community health and the facility levels. Another piece to highlight within the platform is the data analytics and visualization dashboards that the SPICE Insights platform provides. So we have KPIs that are built into the platform for operational and programmatic targets, looking at the screenings, case rates, the referrals, as well as KPIs for the health outcomes metrics. So in the case of a hypertensive or a diabetic patient, we're looking at those control rates. Have patients been able to move from that uncontrolled status to the controlled status? With that, we have dashboards that are focused at the MOH and that subnational level, as well as dashboards down to the facility manager to really assess the performance of health workers and the programmatic coverage. Another piece, and I did see a question regarding this in the chat, is we have automated reporting into national DHIS2 systems. And so an example of that is that we will take the data collected by the Spice platform, create that aggregate report, enable the users to validate the report and the data within that, and then automatically send that into the DHIS2 system. And so one of the tenets of being a global good is building an active developer community and a community around the platform itself. And so before we wrap and move into Q&A, we did want to walk through some of our community engagement and resources. So if you're interested in contacting our team, talking about it, what it might be like to use Spice in more detail, we'll be going through that today. And with that, George, I will hand it over to you to walk through the resources.
Sounds good. Good afternoon, everyone. My name is Jagdish Odhiambo. I'm a system software and software systems engineer at Medtronic LABS. So I lead the community practice work in this, and looking forward to hearing from you anytime soon. So you can reach out to us directly on the online platform at GitHub. That is for developers that would want to adapt our application and just tailor it to save more lives, either on a mailing list. So we have a mailing list, or either directly to a direct email to us on community@medtroniclabs.org. So there's a platform that we have all the code base in, apart from GitHub alone. That is the Spice documentation. Next slide, please. Yeah, so here you will not only find the workflows, but also the architecture documentation about the application. So here you will learn how the screening workflow is, enrollment assessment, all the way to how the reporting is being done. There was a question about whether we have a web-based system. So currently, no, but there are some aspects of the web that we've also incorporated. So aspect like the admin portal is found on the web. So our architecture has 4 main components. So we have the Android application. That was what my colleague Selva was showing, and it is based on Kotlin. And then we have the Spice admin portal. That's a React or web-based application that connects to the Android application to be able to manage and add users in the application. We have the so our server side is in Java, and also the Fire adapter work that we've done is also in Java. So those are the 4 main components of architecture that we have on Spice. So for code base, you might be able to find us here at GitHub, where we welcome all folks or any developer to fork our repo and be able to contribute to this work. Thank you. Over to you, Kelly.
Thank you, George, for going through that overview. And I'd just like to stress again, please reach out, get in touch directly with our team. We love to hear from community members and groups that might have an interesting use case that the Spice platform could be a part of. We're always here to respond directly. One of the best places to reach us is community@medtroniclabs.org, or please reach out to myself, Selva, or George from the webinar today. And so with that, that's all of the content that we have, and would love to open it up to questions.
Thank you for that very insightful and concise presentation, Medtronics team. I can see a question on the chat from Newton Goody. It's a two-part question. Newton, would you just want to come off mute and ask the question? If not, I can certainly read it out. So the first part is, does SPICE have a web-based version for desktop or laptops other than the app version? And the second part of it, does SPICE have an inpatient module which the patient history can be reviewed while admitted, or does SPICE have the ability to print patient history if needed?
Yes, great questions, Newton. To answer the first, currently SPICE is only an app-based tool. So we do not currently have a web-based version. However, it's something that we've been considering on our product roadmap. And just to plug for that product roadmap, you can see our updated roadmap that is available in our SPICE documentation in the SPICE docs. To answer that second question, so SPICE currently does not have an inpatient module. However, using the patient record, a health worker would be able to review that entire patient's history to be able to really see what are the diagnoses, what are the cases, what is that history within that individual patient. We don't currently have the ability to print that patient history, but that could be a feature that we would explore in the future. And another question to highlight, which I had answered above in the chat, was whether or not SPICE has to be used at that facility level. And the answer is that it depends on the facility and the tools that are available. So SPICE can both be used at that facility level, as well as SPICE can be integrated with an EMR system that exists at that facility level to bidirectionally exchange data that way. Taking the next question I see from Thomas, what does community health worker training look like in your existing SPICE use cases? That's a great question. We partner with our Ministry of Health stakeholders to train and equip the community health workers with the SPICE application, as well as the toolkit that they need to screen and assess those patients. So the training's comprehensive. It both focuses on the SPICE technology itself, so getting them familiar with the use of the app, walking them through the different workflows, as well as in a lot of scenarios, we partner with the health system on training on those guidelines and the cases for how to do that referral and the management of care. The next question that I see come through is in terms of data security. So thank you for asking this question. It's an incredibly important one. Yes, so SPICE is aligned with major security standards. And so with our program operations in the United States, we have audited and assessed our application to HIPAA as well as GDPR. We are also fully registered as a data processor in the countries in which we operate our programs. And so compliance with both the international security standards as well as those local country regulations is incredibly important. From a data privacy and security perspective, we have best practices in terms of security and privacy by design. And from a security perspective, the platform undergoes security vulnerability testing with every major release. And we've evaluated our application towards the NIST cybersecurity framework to identify and remediate any gaps. And as an organization, we are currently looking to pursue a SOC 2 status just to further enhance our security profile. The next question that I see, which is a fantastic one, is what role does intelligence play in the future of SPICE to make the workflows less labor intensive, especially in terms of data entry and data management? I love this question, and it's actually something that we did not touch on today, but we do have a team at Medtronic Labs that is focused on data science and AI models. Our team has been building both predictive models to understand how can we take AI and enhance both the programmatic efficiency as well as improve clinical outcomes. We've also been exploring how do we use AI as well as Gen AI to enhance the workflows for the end users. Our team recently completed a proof of concept where we were creating a chatbot for that community health worker for a way to ask questions and receive guidelines-driven responses. And so we're really playing around with how do we take this technology and make it more efficient. We've also been exploring use cases specifically in terms of data entry with ambient listening technology. So could we potentially use that to listen in on the conversation that the physician is having with the patient and do a lot of the transcription so that we're not putting that additional burden on the data entry. The second part of the question that I see here is what role does design for accessibility play in SPICE? And design and working specifically with our end users is paramount. And so with every new feature release and new clinical workflow that we develop for SPICE, we're working hand in hand with our users to get the feedback, to validate the workflows, to really understand, are we building an accessible platform that's easy to use? So we have a full design team. I think a couple of the individuals have joined today, where their full role is making sure that we're gaining feedback from the end users, we're receiving feedback on the prototype designs, we're conducting user acceptance testing, all of which to improve that accessibility and design of SPICE. We've got 2 minutes remaining. I see there's one more question in the chat, so I will try to get to this. Martin says, in terms of the sustainability model, how do you hand the platform over to the local authorities with relevant capacity building to support your platform? And have you successfully managed to do this? Great question. Our goal is full local ownership and adoption of the SPICE platform. We have a path towards this, specifically in Sierra Leone. We have partnered with the government there for them to be able to have the full ownership of the SPICE platform. We have a multi-year project that we are mapping out in order to do that capacity building specifically to ensure that we're building the local expertise to really support that platform and manage it over time. We also have a couple of scenarios where we're working with local technology implementers to build that platform support. And so at Go Live, we hand over the platform to the technology implementer, and they then continue to support and maintain the platform. We maintain a really close relationship with those teams to make sure from a steward of SPICE perspective that we're there to answer any questions that they might have. With that, I believe we are up at time. I see there's a couple more questions in the chat. I will try to answer those offline to each of those individuals. and very much want to thank everyone for their engagement and really exciting questions to wrap up the session.
Thank you, Kelly. Thank you, Medtronic's team, for that good presentation and the rest of the audience for your questions. We will share with you this material shortly after the webinar, and see you next month for our next Global Good, which will be Go Data, presented by WHO. Thank you, everybody, and goodbye.